Hi, my name is Marie Parks. This is my research prospectus on eating disorder prevalence in NCAA Division I and III female long distance runners. So before we begin, here are some concepts to help understand my research proposal prospectus. So an eating disorder, many people know of anorexia or bulimia, but there are many others. Mainly, they are all characterized by a wide range of abnormal and unhealthy eating attitudes like obsession with food, repeated weighing, restricted eating, chronic dieting, and binge eating. And with the binge eating, they can would either purge through the use of laxatives, vomiting, or it can also be through excessive exercise. So long distance running for the purpose of my study will be a minimum of the race that they do of 2 miles, and it can go up to 6 or more miles. Usually, long distance runners compete all year round, fall, winter, and spring in cross country, indoor, and outdoor track. You've probably seen runners, they all wear form-fitting uniforms. The bottoms can be like a bikini bottom, and sometimes the tops are just a sports bra or very tight tank tops. So this can allow the athletes to compare themselves to each other, and that can affect their self-esteem. And stereotypically, faster runners are thinner. You probably have seen major marathon like New York City or Boston, where the winners are very tiny Ethiopians or Kenyans. So my research question is the prevalence of eating disorders higher among collegiate female long-distance runners who compete for a Division I school than those who compete for a Division III school? And I forgot to go over the difference between Division I and Division III for competition purposes. Division I can provide athletes with sports scholarships, whereas Division III cannot. So that can affect what types of athletes will choose to go to those schools. Obviously, if they're a high performing athlete in their sport, such as a runner, they most likely will choose to go to a school that can offer them a scholarship for running versus one that is not able to. So that might make Division One more competitive than Division Three. Okay. So why is this important? The prevalence of eating disorders among female athletes varies between 13 to 50%. Female collegiate athletes represent a population at the highest risk for eating disorders. According to the NCAA, about 25% of female collegiate athletes have an eating disorder. Also, athletes, particularly runners, tend to spend a lot of time together. They practice, compete, travel. They usually live together in the dorms or off-campus housing and just spend their free time together. So if one person has started having abnormal eating patterns, it can spread throughout the whole team, especially if that person is someone that the rest of the team looks up to, maybe a captain or one of the top performers. Females with eating disorders commonly present with the female athlete triad, which is a syndrome of three conditions that can become pretty severe. The conditions all happen at the same time to be diagnosed with the female athlete triad, and those three are low energy availability, which occurs due to insufficient calorie intake and usually overexercise. Menstrual dysfunction. Oftentimes, females with this low energy availability or low calorie intake will stop menstruating due to low body fat. Their body doesn't have enough energy to have a menstrual cycle. And also low bone density. The body will resort to the bones if that's the only source of energy that's available. And that can increase the risk for osteoporosis, osteopenia or osteoporosis, stress fractures, fractures, bones breaking, injuries that could put them out of competition. Um, Other risks are dehydration and electrolyte imbalance that can cause cardiovascular issues. Also, low energy and fatigue can contribute to mood disturbances like depression, OCD, and even can increase suicide risk. So being aware of who's at risk and what types of risk factors to look for, eating disorders can more easily be detected so that proper intervention can take place. Also, awareness of eating disorders characteristics and who's um, at the most risk, teammates and coaches, as well as trainers, can help prevent them from occurring in the first place, which can lead to a healthier and happier team with less injuries, and also can make their ceiling higher for their ability to perform at a high level. So I looked at some research to see what types of studies were already done on this topic of eating disorders in athletes. I found some that analyzed what factors predispose female athletes to develop eating disorders. For example, some athletes reported factors such as performance pressure, team weigh-ins, and injuries as reasons why they developed disordered eating, compared to non-athletes who reported that their main factors were bullying, puberty, and family dysfunction. Characteristics. So female athletes tend to be perfectionists with a strong motivation and drive to succeed, which unfortunately are also characteristics that could increase their risk of an eating disorder. There were some research studies looking at eating disorder prevalence or risk among diverse types of athletes, and most of these showed a higher risk of eating disorders among athletes who participate in sports that have weight classes like wrestling, and a stigma that slimmer equals faster and higher, like gymnastics, figure skating, as well as long distance running. So in my search, I could only find one other study that compared eating disorders, and this one also looked at body image disturbances in Division I and Division III athletes, but they looked at a variety of sports like basketball, softball, soccer, track, etc. And they found that about 10% more Division I athletes were in subclinical eating disorder ranges than the Division III athletes. This shows that body image risk factors do vary between competitive divisions, and this is what I expect to find or similar results in my research design. So my area of opportunity, or where the research gap is, as I mentioned, is the same sport. There are currently no studies comparing eating disorder prevalence among the same sport between different competition levels, which is why I'm proposing to study or compare the prevalence of eating disorders among Division I and Division III female long-distance runners. So my subjects, in order to determine what number of subjects I need to obtain a statistically significant result, I will use the G-Power program. As I mentioned, there will be female long-distance runners in college, so freshman through senior. Division I school for this initial pilot study will be Duke University, and Johns Hopkins University will be the Division III school. My study is targeting female long-distance runners in college, so this is a very specific sample of subjects, so therefore we'll be using purposive sampling. Prior to each season, athletes have to fill out forms and have a physical to make sure that they are healthy enough to practice and compete. And like I said, long-distance runners compete almost all year round, fall, winter, spring. So there's 3 times where they would have these exams. So the study questionnaire would be included with those papers or forms as part of the clearance physical, along with an informed consent form. So the instruments that I'll be using, the main one is the female athlete screening tool, also known as the FAST, which I'll get to in a moment. And also BMI, which I'll be collecting but not using initially in this study, but it will be good information to have in case there is a relationship that's found in order to look more into the details of this relationship. So the FAST, the female athlete screening tool, is validated for female athletes. There are a lot of different tests that measure eating disorder prevalence or risk. The division comparison study that I mentioned before used a test called the Eating Attitudes Test 26, which some studies have shown that that test is better for analyzing eating disorders among the general population, not athletes. So the FAST has 33 questions, each with 4 answer choices that correlate to the number of points, 1, 2, 3, or 4. So at the end, when you add up the score, if it's 79 to 94, it's considered a subclinical eating disorder, and if it's above 94, it would be considered a clinical eating disorder. So I'll use the chi-square test to find out if there's a significant difference in the number of eating disorders between female long-distance runners on Division I teams compared to Division III teams. There's a couple limitations of my study. As I mentioned, this is a small scale study using only 2 schools, and this is only females in the study. There are no males, and they're only college students, no high school or professional athletes. So my suggestions for future research would be to look at this experience in men. There are some studies that were saying this is a major gap in the research. Most of them do focus on females, so men should be looked at too. That's often overlooked because they don't have the female athlete triad that they can come forward with to show that they have an eating disorder, so it might be a little harder to diagnose. Also, it would be good to look at more schools, but for funding purposes, starting out with 2 schools. And then eventually it would be good to look at, high school recreational sports where you're not on a team, and maybe even professional or elite athletes as well. Thanks for listening.